Today, let's compare Ticagrelor Monotherapy and Ticagrelor plus Aspirin among patients with acute coronary syndrome combined with high risk of gastrointestinal bleeding after percutaneous coronary intervention, a retrospective cohort study. To date, no studies have specifically examined the efficacy of P2 white cell inhibitor monotherapy in patients with acute coronary syndrome exhibiting a high risk of gastrointestinal bleeding following percutaneous coronary intervention. A retrospective cohort study of acute coronary syndrome exhibiting a high gastrointestinal bleeding risk after percutaneous coronary intervention admitted to the affiliated hospital of the Jiangnan University from August 2016 to December 2019. Of the 308 enrolled patients, 269 were found eligible and were assigned to the Ticagrelor monotherapy arm and to Ticagrelor plus aspirin arm treatment for a 1-year period. The primary study outcome was a composite endpoint including bleeding academic research consortium type 2, 3 or 5 bleeding and adverse cardiac or cerebrovascular events in the Ticagrelor monotherapy group and 14 in the combination treatment group reached the primary ischemic endpoint within 1 year with no significant difference between these groups. BARC type 2, 3 and 5 bleeding events affected significantly more patients in the combination group relative to the Ticagrelor monotherapy group. As the follow-up interval was prolonged, the cumulative BARC type 2, 3 and 5 bleeding incidence in the Ticagrelor monotherapy group remained significantly below than that in the combination treatment group. To conclude, these results indicate that Ticagrelor monotherapy is associated with a lower risk of clinically relevant bleeding events among acute coronary syndrome with a high risk of gastrointestinal bleeding after percutaneous coronary intervention relative to combination of Ticagrelor monotherapy plus aspirin treatment, although ischemic outcomes in these two groups were similar.